Hello, and welcome to the Clinical Care Options Oncology Podcast. I'm your host, Tim Quill. This episode features a call to action and reflection from a physician caring for transgender patients. It is part of a larger educational program entitled Multidisciplinary Approach to Ensure Inclusive, Compassionate, and High-Quality Healthcare for Transgender Individuals. During this podcast, Dr. Nelson Sanchez from Memorial Sloan Kettering Cancer Center and Weill Cornell Medical College will be interviewed by Rachel Andre, a scientific director with our group, sharing his insights and clinical experience caring for transgender individuals. Discussion topics include communication and physical exam skills for optimal care of transgender individuals, specific clinical care needs related to transition, and creating a more inclusive and welcoming environment for transgender patients and healthcare professionals. For more information on Dr. Sanchez, along with a link to the complete program, please visit the show notes for this episode. Now let's get started and hear what Dr. Sanchez has to say on this important topic.
Hello, my name is Dr. Nelson Sanchez. I'm an associate professor of medicine at Weill Cornell Medicine and Memorial Sloan Kettering Cancer Center. I also serve as the chair of Weill Cornell Medicine's LGBTQ+ steering committee, and I co-chair the annual LGBT Health Workforce Conference, which is celebrating its 10th anniversary in 2022.
So, who are transgender individuals? Tell us a little bit about what we're going to talk about today.
Sure. So, transgender is an umbrella term for individuals whose gender identity, gender expression, or behavior doesn't conform to that typically associated with the sex to which they were assigned at birth. Although there's no specific U.S. Census data for transgender individuals to self-identify, according to reports from the Williams Institute and various peer-reviewed scientific publications, transgender representation in the U.S. ranges from 0.4% to 0.6%, which roughly translates to about 1 to 2 million Americans living across the country in every state, in every community, including big cities, suburban communities, and rural areas, and diverse by age and race ethnicity.
So why is providing inclusive, compassionate healthcare to transgender individuals important?
Well, in order to achieve health equity in our country, we need to identify and understand historical gaps in access to healthcare for transgender individuals and address these problems. For example, a 2020 Center of American Progress study found that nearly half of transgender adults report having negative or discriminatory experiences with a healthcare provider, and nearly 1 out of 2 transgender adults had insurers deny them coverage for gender-affirming care. Research has shown that transgender adults are significantly less likely than cisgender adults to have flu shots and routine doctor's visits. According to a 2019 Behavioral Risk Factor Surveillance System study, 3 out of 5 transgender respondents reported experiencing poor mental health at least one day in the past month. And this is a rate 23 percentage points higher than that of cisgender respondents. Transgender adults are 4 times as likely as cisgender adults to report making at least one suicide attempt in their life. And 54% of transgender individuals reported poor physical health at least one day in the past month. That's a rate 18 percentage points higher than that of cisgender respondents. So I just wanted to highlight those statistics just to show the disparities that exist within the community and what we need to do to truly achieve health equity in our country.
So who needs to be trained about the healthcare needs of transgender individuals?
Basically, anyone in the healthcare community that interacts with patients needs to be trained in transgender healthcare. So this includes all clinicians and clinical staff. It starts at the training level. So all of our students, nursing students, medical students, PA students, all allied health professionals in training. There really is a need for transgender healthcare curricula at all levels of training. And then as we move into established healthcare professionals who may have never received any training, we're talking about senior doctors and nurses, staff involved at the front line, at registration desks, people involved in transport of patients, people in phlebotomy, radiology, anyone that interacts with patients needs to be informed about transgender healthcare needs, how to communicate with patients, how to examine patients, And how we do that once someone has completed their traditional training involves continuous education and training on the job or continuing medical education activities via conferences or other local events. It's very important that we continue to train and educate our students and our staff about ongoing best practices in the community so we can best meet their healthcare needs and optimize health equity.
Yeah, I have heard stories from people close to me about kind of the medical voyeurism, like during imaging and things like that. So important for all of these folks. What skills do healthcare professionals need to learn to provide optimal care to transgender individuals?
There are a lot of skills that healthcare professionals need to learn to provide optimal care to transgender individuals. In terms of communication skills, there are nonverbal skills, right? With every patient, you want to maintain eye contact. You want to approach a patient in a private space and not ask private questions in a public arena, which is in a crowded emergency room hallway, right? You want to discuss issues related to gender identity and sexual behavior in a private space. And then when you're talking to an individual, you want to use appropriate language to unveil their gender identity and related information, such as related surgical history, related hormone therapies that they may be using. So some questions that you can use to unveil gender identity include, how do you self-identify? And give examples. Do you identify as man, woman, trans man, gender nonconforming, something else? You should ask, what pronouns do you use? He, him, his, she, her, hers, they, them, their, or something else. If someone identifies as transgender, you should ask about what hormones they're using. How do they access the hormones? Are they accessing them from prescription, from the black market, from friends? What formulation are they using? Are they using injectables? Are they using safe and clean needles? Are they sharing needles? Are they using oral formulations of the hormones? Are they using patches? And when it comes to a surgical history, you want to ask about any gender-affirming surgeries that a patient may have pursued. You also want to take a thorough sexual history, right? Ask about what kind of sexual behaviors they engage in and whom their partners are. And also ask about housing. Do they have safe housing, reliable housing? Are they currently employed? Do they feel safe in their neighborhood and their home? These are appropriate questions to ask to really get a great overview of someone's current health status. And then in terms of physical exam, some best practices include, before starting a physical exam with a transgender patient, inviting a support person in the room for the exam and explaining what parts need to be examined and why, right? We don't want to be a medical voyeur and examine parts that are not related to why the patient is there for their visit. You really want to only examine what is medically necessary. I would ask the patient what they call their top and bottom parts. And when I say that, I mean top parts is the parts in their chest or their breasts, and bottom parts referring to anatomical parts in their pelvic region. I'll share an anecdote. When I was with a patient once in the emergency room, they presented with swelling below their hips, and it was a trans woman who had their natal anatomy and their scrotum was very swollen. And I asked the patient, for how long has your scrotum been this swollen? And the patient wouldn't make eye contact with me. I could tell that they were not comfortable with the conversation. And I kept saying scrotum repeatedly. I wasn't sure if they didn't hear me or what the barrier was, but it took me a while to just leave the room and just think about what did I do wrong there. And I think constantly saying scrotum to the patient was traumatizing. And going back, I would have said, this part of your body is swollen. What do you call this part of your body? Possibly they've renamed it to something else and take it differently from that approach. So just recognizing that patients may have renamed their body parts and asking them before you name them, potentially committing further trauma. So additionally, based on a patient's reported anatomy, you want to provide appropriate counseling in terms of health maintenance and care. So for trans men, you want to think about access to cervical pap smears and mammograms. For trans women, access to prostate cancer surveillance, and for all your transgender patients, access to lung cancer screenings, colon cancer screenings, skin cancer screenings. So for example, in terms of cancer screening, the patient retains their natal cervix, you want to offer a cervical pap smear, and particularly for trans men, a cervical pap smear can be traumatizing and uncomfortable depending on what services are offered to them. So some patients may prefer to come during specific office hours, or you may want to offer them a home testing kit for cervical cancer screening. Some other things to think about are inclusive STI care or care for sexually transmitted infections, HIV screening for all your transgender patients, and particularly for trans women who have shown to be at higher risk for HIV disease.
What do healthcare professionals need to know about the specific clinical care needs of transgender individuals related to their transition?
There are a lot of clinical care needs that healthcare professionals should know about in terms of transgender healthcare. I'll touch on several right now. There's hormone therapy that some transgender individuals pursue. When I talk about hormone therapy, I'm talking about masculinizing and feminizing hormone therapies. So it's important to know what is the patient's history with hormone use. They're on a current regimen. Are they satisfied with their current regimen? If they're currently using hormones, how are they accessing them? Are they accessing them safely via prescription? Or are they obtaining them from friends or off the black market and maybe using them at inappropriate dosages or inappropriate formulations? Is the patient using injectables versus oral formulations versus patches? If they're using injectables, are they obtaining safe and clean needles? Are they using appropriate dosing? Some patients use higher dosing than is normally recommended because they want to achieve faster or more immediate effects. And then what lab test should you monitor before a patient starts hormones and while they're on hormones? So for example, before starting hormones for trans men, you'd want to obtain a baseline hemoglobin and then monitor a trans man's hemoglobin while receiving testosterone. When thinking about gender-affirming surgeries, it's important to remember that not all transgender patients pursue gender-affirming surgery. It is something that is available if they so do, but a large portion of transgender patients do not pursue all gender-affirming surgeries. I would say many clinicians think about top and bottom surgery when they think about gender-affirming surgery, and it's important to know what are some common procedures and options for patients and common post-surgical complications such as fistulas, urethral stenosis, poor wound healing. Many times, transgender patients, first and foremost, worry about facial appearance, right? And oftentimes that's the first time you'll see somebody, right? You'll see their face. So transgender patients, many of them are sensitive to their facial appearance and oftentimes pursue procedures to optimize gender affirmation via their facial appearance. Other topics relevant to transgender care include access to care, so having adequate access to health insurance, having reliable employment, having adequate financial resources to support optimal housing and shelter. Another thing to be mindful of as a clinician is support services for your transgender patients. Do they have adequate mental health support before, during, and after transitioning?
What other topics are important to consider to provide optimal clinical care to transgender individuals?
Another thing to think about are support groups within the community and support groups for different aspects of their health, right? Someone's trying to quit smoking, quit alcohol, if someone's a victim of domestic violence, if someone was just recently diagnosed with cancer, are there transgender specific support groups or LGBTQ specific support groups that you can refer your patient to? Some patients don't care what support groups they're sent to, but for some, it is really important that they are referred to a safe space for healthcare support. And then thinking about other communities within the transgender community are elders. Do we have referrals for inclusive end-of-life care, palliative care, trans-friendly pastoral care? And in terms of our children and adolescents that are transgender, ensuring that they have a safe home, a safe neighborhood, ensuring that their parents are well supported and informed, ensuring that their school is well informed, can be another support system, and making sure that our children and adolescents receive appropriate gender-affirming care as it regards mental health, hormone care, and gender-affirming surgeries, if those are so desired. You also want to have images in your clinic and hospital that are inclusive of transgender communities and patients. You want to ensure that your bathrooms are gender neutral at your hospital or clinic site, you want to have registration forms that are inclusive of all gender identities, right? That's a cue to a patient that, okay, the staff and clinicians here are aware and open to all gender identities. You want to educate your staff at registration desk, your waiting rooms, and transport services on best practices in care for transgender patients. One thing you want to avoid is having patients be called by the incorrect name or the incorrect pronouns while they're in your waiting room, or being called by transport to be taken somewhere. And there's just some basic education that you can provide to your staff to avoid that and inform them on optimal care. So those are some other things to think about.
Considering the challenge of identifying underrepresented minorities, what can we do to support the inclusion of transgender individuals in clinical trials? I might add, do you want to provide a little bit of a foundation on whether or not they are even included?
So although there isn't uniform inclusion of transgender individuals in clinical trials, some research has shown that there are many barriers to inclusion of transgender individuals in clinical trials and poor overall participation. Some things that we can do to mitigate these barriers include educating our research staff on best practices in research work with transgender patients. So we want to train our staff and our researchers to be cognizant of transgender identities, best practices in recruitment, enrolling, and studying transgender patients, ensuring that our enrollment forms, our advertising materials are inclusive of transgender identities or are gender neutral when appropriate. We want to ensure that if a transgender patient has to receive care at a specific research site, be it a clinic or hospital, that site is transgender friendly, right? So piggybacking off what I've said earlier, making sure that the site has gender neutral bathrooms, has images throughout the clinic or hospital that are inclusive of transgender identities. If the clinical trial involves gender specific research, we want to make sure that the research activity doesn't exclude transgender people. So for example, if it's a clinical trial that revolves around cervical cancer, we want to ensure that the materials are inclusive of trans men, right? Because trans men, if they have retained their natal cervix, should be included in any cervical cancer research as appropriate. Also, similarly with breast cancer research. And another thing to think about is hiring trans-identified researchers and staff to recruit, enroll, and study transgender patients, right? We would like concordant researchers involved in clinical trials so that when transgender patients are approached or involved in a research project or clinical trial, they can see concordant researchers and staff that are invested in the health of their community.
Along those lines, how can we support our transgender-identified healthcare professionals in the workplace?
So there are many ways we can support our transgender-identified healthcare professionals in the workplace. One thing we want to do is ensure that our work site provides adequate insurance that includes gender-affirming care. You also want to sponsor regular networking events at your hospital and clinic that is inclusive and celebratory of transgender identities. We want to ensure that we have a supportive work site. So working with our human resources departments at our hospitals and clinics to ensure that our staff are well supported and included, that there are opportunities for promotion and advancement, that our staff are involved in institutional committees, be it QA committees or IRB committees, ensuring that there are robust opportunities for our transgender staff and faculty to be involved throughout all the inner workings of the hospital and clinic is very important. Thank you for listening to today's podcast. We welcome your participation and engagement in the other educational activities we have developed for you.
Thanks very much to Dr. Sanchez for his excellent insights, and thanks to you, the listeners, for joining us. As a reminder, to view the full program, multidisciplinary approach to ensure inclusive, compassionate, and high-quality healthcare for transgender individuals from the Clinical Care Options website, please click on the link in the show notes. As always, thanks for listening.